So I have plenty of those success stories, and one is very close to my heart. Actually, a lady from Lucknow. Actually, she was unmarried. She was 35, and her marriage was fixed in the month of November something. And she had a chance of around 5 to 6 months to get back to the normal. So her parents, actually elderly parents, carried her to my center, saying that she has disc lesions around 3 to 4 levels. So when I saw her MRI, I was surprised. A 35 young girl, uh, which she's suffering with so many disc lesions, and most of the surgeons they were consulted, everyone offered surgery, and they were not in the typical state of getting surgery done. When I examined, yeah, of course, she was not able to walk properly, and she was not able to sit at all. I had an hope that her nerve was functioning good. When I saw her MRI, there was a good compression on the spinal cord and the nerves. Because of the request of the patient and their parents, because her marriage was fixed in other few months, then I started with the normal therapeutic protocol for the spine, what I usually do it. So I told the patient, if at all it improves, it is your luck. If at all no, then I may have to operate at any time. So the patient agreed for this, and we started treating her from the day one, started with the decompression therapies, medication, so many stuff. Then I started NMR treatment. So she actually told it was not that comfortable. Initial first few days, she told that she was having a lot of pain. I tried to continue. At the end of 5th day, I spoke to her. She told, I used to speak with her every day. So the reviews and feedback I used to collect every day. And at the end of 5th day, she was slightly happy, and she actually walked to my clinic on that day. And till that day, she was actually taken by her parents with the wheelchair. And 5th day, actually, she came walking to the center. She took the treatment. End of 9th day, she was almost fine. The radicular pain came down. The exercise protocol we started, hoping that she may recover this condition. The exercise been introduced, and she started doing all the exercises. She started modifying all her lifestyle activity and changed her diet. At the end of 3rd month, actually, she came with a marriage invitation card with me, and she told that I'm doing this because of the QR machine, or it's always the patient. She showed that gratitude to us, and she got married. And after a year, actually, I called her myself, and I collected the data. How is she feeling and all? And when I called her, I got a very surprising news that she conceived, and she has been 5th month now in another gestation period. I was very happy. And this boosted my confidence in treating all this fine, even the younger or the elderly age group. So she came in a wheelchair, she walked out happily, she got married, and she conceived after a year. When I saw her repeat MRI, we have seen some changes in her MRI comparing with the previous one. The compression on the disc the compression on the spinal cord and the nerve roots were drastically reduced. Ultimately, she's happy, I'm happy. We are actually thankful for the technology, as well as I'm actually thankful for the patient to trust us and the technology.